Hello folks, I'm Dr. Fazil. You're watching May 2025 edition of Dr. Fazil TV show. I'm a kidney specialist as well as internal medical specialist. So today the topic for discussion is some tricks and tips to get on the kidney transplant list, which is one of the final way before you get kidney transplant. Anybody who's have a chronic kidney disease, they are always worried that if they need to go on a transplant, dialysis, what are the options? So over a period of time, I've learned some tricks and tips which I can pass on to the patients, which can help you to either, if you're on the stage. Let's talk about the stages of the chronic kidney diseases. Stage 1 to stage 5, 2, 3, 4, and 5. So it's based on your kidney function. So when your kidney function is between less than 15%, that's where you need to be on some kind of dialysis, either hemodialysis or peritoneal dialysis. So if your kidney function is less than 21%, a lot of people don't know that you can actually be on the transplant list if your kidney function is 21% or less. And that is before 15%. That means you can be not on dialysis, still in stage 4, but you can still get on transplant list. And that can, and you might be on that stage for 2 years or 3 years before you need transplant. Folks, I let you know that in Arizona, which is one of the best states to get transplant, the waiting time is around 2 years. So most patients get, if there's no contraindications, which is, like active cancer or infection or advanced age, then you can get your transplant within 2 years. So you can avoid active dialysis 100% if you stay active at 21% or less than 21%, and you qualify to get on transplant list. So you don't have to go on dialysis to go on the transplant. So that's the very important trick and tip, how to stay away from dialysis or avoid dialysis if you get on list before you need a dialysis. Other thing is, if you do go on transplant on dialysis, get on the transplant list right away. They will do a bunch of tests, transplant centers, and they want to do it just to make sure that you're in a good shape, good health. Work with them, get those clearance or medical stability for the transplant. So once you're in the transplant list, this is from the deceased donor, by the way. So if you have a living donor, the time frame is even less, right? That could be a few months. So if there's a compatibility between the recipient and donor, then the time could be even less, right? But this is from the deceased donor list, right? So like cadaveric or diseased donor, if somebody is if you're getting from a cadaveric donor, then that's what we're talking about, 2 years or less than 2 years. But if you have a family member or somebody who is a match, then the time could be very, very short. But if you don't have a perfect match, they have a transplant program, have a system where they can swap the kidney with your donor's kidney with somebody else, and somebody else might have a match with you. So they have that computer program where they can do a swapping. So you might still get transplant from a living donor, might not be from your friend or family, but you still get from a living donor. And living donor is always better than a diseased donor. It lasts longer, and then you have to wait less to get transplant. So folks, those were the few tricks and tips on how to avoid kidney transplant, and if you do get on transplant list, how to get it fast. So that was my talk of the day, folks. So we will get back with you next month with more information about the kidneys and related kidney problems, folks. On that note, I will call it a day. God bless you and God bless America. Have a nice day. You were watching Dr. Fazil TV show. Thank you so much.